So what constitutes a quality colonoscopy? The clinical care standard helps to define some of the important points in this regard. Initial assessment and referral is important to get an accurate history, examination, and understanding of why and whether a procedure should be performed. If a decision is made to perform a colonoscopy, it ought to be within recommended timeframes, and there needs to be appropriate consent and decision making that's shared between the clinician and the patient. This involves appropriate explanation of the indications, the type of treatment, benefits, but also risks. It's important to have appropriate explanation of bowel preparation and to aim for excellent bowel preparation every time. This would avoid missing lesions or potentially having to repeat the procedure due to suboptimal bowel preparation. A discussion around sedation needs to be had with the anaesthetist to ensure that the procedure is safe and painless to the patient. There needs to be certain key performance indicators that clinicians meet, including being certified to perform this procedure, being adequately trained, reaching the very beginning of the colon or cecum the vast majority of the time, having at least good to excellent bowel preparation on most occasions, carefully examining all of the colon with an acceptable withdrawal time so as not to rush the procedure, and to appropriately and completely remove lesions or take samples and finding lesions or making a diagnosis. These need to be submitted for pathological analysis. There needs to be appropriate discharge instructions, both verbally and written, so that the patient is aware of what needs to be done immediately following a procedure in the days to come and what to look out for. And it's very important to have follow-up planning in place to document to the patient and the referrer about what the next steps are. It's important as a patient to find out if all of these are being done at the institution where you plan to have your colonoscopy.